I hate to feel like that. And as you study and prepare for your exam, you don't want that to happen as well. Hello guys, welcome back to the channel. It's been a while, and there's a lot that have transpired in the past year, a lot of changes. I've had to move back and forth, certain things that I might have to catch up with you guys on as we go along. But in today's video, I'm going to be looking at loneliness among medical students, especially students preparing for the USMLE, and ways you can actually try to deal with them. And at the end, I'm going to share with you how I deal with it, particularly being the type of person that I am. And if you're like me, then maybe you would find that very helpful as well. If you know someone that's preparing for the USMLE, and if you've spent any amount of time preparing for the USMLE yourself, then you know that as students delve into this complex material, they're trying to memorize, they're trying to understand, you're trying to remember all of this information so that you can pass these big exams in front of you. Some people have to do it for USMLE Step 1 and then do it for USMLE Step 2 and do it for USMLE Step 3. It really begins to take a toll on the students. You feel isolated. You have to cut off a lot of things, friends, family, social media. You have to minimize certain interactions that you would normally have or normally need for you to carry on with your day-to-day activities. Personally, I didn't know how important this was and how important that social interaction really was for students until throughout last year. I had about 3 students bring it up in conversations, and a number of these students broke down as they were talking about it. I was like, it's really that deep, and I decided to make a video of it. Of course, you want to understand that you are not alone feeling this way. There are a lot of students all over the world that feel really isolated, even when they are with their family. And in fact, especially when they're in their family, because family does not often understand exactly what you're having to deal with. And so everybody's on your neck. Some people are going to tell you, are you the only one studying for medicine? Why are you locking yourself up? We need to do this. Come, let's have fun. Sometimes your friends don't even understand exactly what you have to deal with or what you have to go through preparing for this exam. But you must remember that other medical students understand. A lot of medical students are going through exactly what you're going through. And you want to find comfort in that. People have gone through it, they've done it, and I know that you can do it as well. The first thing you want to do is create a study group. A study group is very helpful. I'm not a big proponent of study groups, generally speaking, but in this situation, a study group can be very, very essential and very, very useful for you. And study groups will do a number of things for you. Study groups, of course, they will help you with your academics, your reading, your sharing ideas with all of these people. They're going to help you learn the information better, understand the information better, and remember for a longer period of time. But in addition to that, study group will provide you with that crucial social interaction that you're looking for. Because when you're done studying, most of the time you're going to have conversations. Hopefully you guys will not be having drama in your study group, but you have conversations, right? You catch up on a number of things, and this will help you keep going. You don't feel so much like you are isolated as much. The other thing is that study group is going to provide you with motivation. You see, even myself working here, because I do this by myself for the most part, there are days when you wake up and you don't feel like doing anything. But if you know that there are people waiting on you, there's a group you have to meet, then you can't go a whole day without doing anything. You have to get up, at least you have to meet with the group, and you get that fire, you get that momentum going by having people to keep you accountable, having people to continually build your spirit in that form. The second thing you want to do is to engage in online communities. Don't go down the rabbit hole of saying, okay, I want to just go on Reddit and do one thing, and then you do a million things. No, there are medical communities online, USMLE forums online, on Reddit, on Facebook, on Instagram, a lot of places. You may want to go to these places, interact with other students, leave your comments, have a conversation where the conversation is happening. And in many situations, you don't actually feel as isolated as you might be, or at least you realize that there are other people in other places that are going through the same thing you're going through. You see people's ideas, you learn from people's experiences, and it will help you go easier with whatever situation you're in at the moment. The third thing you want to do is seek professional help. There are a lot of schools that have counseling services, or there are counselors in the society in general. But many times the school provides counselors for students. Be wary of getting a mental health diagnosis, but you want to use the services of a counselor. A counselor is probably going to help you know exactly what it is you're feeling. You can talk to them, they will listen to you, they will share ideas with you, and you find new strength again to keep going. So if you have counselors you can speak to, or a family member that is really like a counselor for you, you can speak to them and they'll give you strength, they will help you cope along the way. Number 4 thing you want to do is take care of your health, especially your mental health. Exercise as often as you can. 10-15 minutes of exercise every day is very helpful. You see, personally, I sit here and I work on these computers all day. If I'm not working, teaching, I'm watching something. The point is, I'm sitting on this chair all through the day. And there are days when I begin to feel groggy. I begin to feel not so, you don't feel very good. Those times remind me that, look, get on the ground and do some exercises. I hate to feel like that. And as you study and prepare for your exam, you don't want that to happen as well. You want to be able to work, study, whatever, and make sure that you're also taking care of your body, you're taking care of your health. Because at the end of the day, you don't want to burn out. You want to keep the energy going, strength, right? Because when you read for 2 hours, 3 hours, and you get exhausted, if you work out, if you exercise, and you're feeling healthier, you can actually study for a little longer. And that is what you are looking for. Finally, you want to keep perspective and stay positive. Keep perspective and stay positive. This is super, super important. You have to remember why you started. Frustration builds on much faster when people forget why they are doing what they do. Strength to continue wears out much quicker when people forget why they are doing what they are doing. So if you're studying for so long, it begins to wear you out. But you want to remember, I'm on this journey for a reason. I'm on this journey ultimately to become a doctor. I'm on this journey ultimately to achieve this result and that result. And I'm inching closer and closer to this goal every day, despite how I feel right now. Understanding this is going to put you in perspective. There are times when even people around you are not going to be very helpful. People are going to say, are you the only one studying for exam? How are you locking yourself in a room and studying all day? You're studying too much. I've heard people discouraging my students, literally while I was on the call, telling her, you've been in this room since morning. People will tell you that, but you know why you are doing this. You understand that it is a challenging process. You understand that the resources are not easy to get through. And it is a sacrifice you're giving in or paying to get to this point. So keep perspective. Always remind yourself of that. I have this plaque on my table that reminds me of the type of thoughts I want to be thinking when I do everything I do every single day. So keep perspective, stay positive, remember the goal, and you will get it eventually. Finally, how I deal with it. For me, loneliness is what it is. I perform better when I'm by myself, in a way. I think it was Alan de Botton, if I remember correctly, I'll find it, I'll put it somewhere here, that said that loneliness is a kind of tax you pay to atone for a certain complexity of mind. In many situations, you will need to isolate yourself to grow. In many situations, you will need to isolate yourself to actually be able to focus fully to develop yourself to where you want to be. A lot of times, you need to cut off a lot of things, cut off the noise, and just put your mind into this one thing and get it done. Okay? It is the tax you have to pay to atone a certain complexity of mind. That is what you're doing. Going through the USMLE process, you're learning a lot of information, a whole lot of information. And for you to be able to do that, oftentimes, it's going to require some sacrifice. So what do I do? For me, I just accept it. And a lot of people around you may not understand. Your family may not understand. But then again, remember this. The rarer you are, the rarer it's the people that understand you are going to be. So most people around you are probably not studying for the USMLE. Most people around you are probably not planning to be doctors to even start with. So you cannot listen to those voices. Your only goal is the one you have set in front of you. You want to become a doctor. You want to pass the USMLE. Step 1, step 2 CK, step 3 in some cases. And for you to be able to achieve this, you have to focus 100%. And if that means that you need to be isolated for a bit, for a period of time, 3 months, 4 months, then maybe that is what it is. This is how I look at it, and this is how I have dealt with situations where I feel like I'm completely by myself for the longest time. that is it. So remember, engage in online communities. Remember, find a study group. If you have to, 2-3 people will be wonderful. Exercise and take care of your mental health. Seek professional help. Use your counselor from your school if you have one. And finally, maybe just accept it. Remember to keep perspective. Stay positive. Until next time and until I see you again, my name is Uche Kennedy. Please like, share, subscribe, and I will see you guys in the next video.